And welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, the Minister of National Security, the Honorable Stuart Young, and the Chief Medical Officer, Dr. Roshan Parasram. The Minister of Health, the Honorable Terrence Deyalsingh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, my colleague, Minister Donna Cox. And I want to thank you for the wonderful job you have been doing over this whole pandemic response. Good morning to my other colleague, Minister Stuart Young, Chief Medical Officer, who has been doing yeoman service, representing the best of the public service, and on whose advice the country relies on. Good morning to ladies and gentlemen of the media and the listening and viewing public, wherever you are. Ladies and gentlemen, the world is still, and I want to emphasize the word still, in the grips of a global pandemic that has so far killed 284,674 persons around the world. When one considers that the population of Trinidad and Tobago is just 1.4 million, if this was only in Trinidad and Tobago, we would have been decimated. We may have ceased to exist as a country. 284,000 people around the world have died. The total number of cases keeps escalating. It is not going down. It isn't plateauing. It keeps escalating. As of now, there are 4,215,317 cases around the world. What is the population of the Caribbean in the CARICOM region? About 6 million, Minister Young?
Yeah, less than that.
Right? If this was the Caribbean or CARICOM, CARICOM would have been obliterated. Obliterated. The reason for giving you these statistics is to tell you how nervous we are at the Ministry of Health today. Because today starts phase 1 of a very well thought out plan based on the advice of public health officials, based on the learnings and mistakes of other countries that tried to flip a switch and open their economies too soon, too quickly. I want to give you 3 examples to show that whilst we can't make everyone happy today, the decisions that we take from a public health perspective based on our public officers is meant to secure the long-term future and health of 1.4 million persons. I want to quote from an article. A cluster of coronavirus cases in California was traced to a coughing patient at a birthday party. And that led to what is called a large number of families and friends who are now infected. This happened last week. So you go to a birthday party, you cough, no one is wearing a mask, and you infect a whole community. In South Korea, where nightlife was allowed to open, on Saturday at the Prime Minister's press conference, I gave the statistic that one 29-year-old man went to a nightclub and infected 29 persons. But boy, was I wrong. 48 hours later, it is now 85. One man going to a nightclub infected 85 people, and South Korea now has to trace 5,000 people because they relaxed their measures too soon. And because of that, South Korea is now forced to go into a seesaw, because before this one case infected 85 persons, they were planning to open schools. Because of this one person going to a nightclub district the whole country has to rethink the opening of schools. The point I am trying to make, ladies and gentlemen of the media, and the listening public, and the business community, is that the measures we are implementing in phase 1 is a gradual, well thought out strategy to protect Trinidad and Tobago. We know we can't please everyone. All our cases so far can be traced to importation. But with the relaxation that starts today, we cannot blame importation again. It will be local transmission. It will be community spread. And the last example is that from Wuhan, China, which was the epicenter of the global pandemic, that took very stringent action, and they have started to reopen. You know what has happened in Wuhan? 5 new cases from one worker infected her husband and her family since the easing of restrictions. Ladies and gentlemen, these are just 3 examples from 3 parts of the world: California, South Korea, and China. And we can't blame importation. We can't blame visitors. We can't blame returning residents from today as we start to ease restrictions. What are we trying to do from today? From today, based on public health advice and based on these experiences that we have been tracking, in phase 1, which starts today, all food establishments can open, but for only takeaway, drive-in. All street food can be sold, so doubles, the pie man can come out, the gyros man can come out. This will start to stimulate some economic activity, get people back in job. It's a very fine line that we are walking. It's a balancing act. This is not playing checkers. This is playing 3-dimensional chess. So complex it is. We are asking persons, yes, start to go out in public and exercise, but only for solitary sport. No team sports, no cricket, no football, no basketball, no netball, no crowds watching you play. You want to go out and walk and cycle, you can do that. So no contact sports. Hardwares, as of today, can now open 8 to 4, including plumbing stores, electrical stores. Go in, get what you have to get, and then leave. Supermarkets, groceries, markets, pharmacies can open. Pharmacies until 8 p.m. tonight, and supermarkets and groceries until 6. And I just touched my face. So, ladies and gentlemen, these are some of the measures based on public health advice. These are not measures meant to punish anyone, but these are measures to ensure that the next 2 weeks gives us some sort of experiment, because we have no case study to go on. We have no precedent to go on to say last year when we eased restrictions, we got 100 cases. This is new. This is brand new to Trinidad and Tobago. We have no past history to tell us if we ease restrictions, we could expect 100 cases. What we are saying from a public health perspective, based on the best advice, which has led us to this place, is that we don't want a seesaw of doing things too soon. Then you have to clamp down like South Korea, which had to delay the opening of schools. We don't want that. We know that these measures are difficult, but at least we are starting to get thousands of people back into the employment cycle. We are starting to get the doubles workers, which are sole traders, the nutsman, the pie man. Let us all heed the advice. And as I close, the advice moving forward is this. We have to make the public health measures that we instituted parts of our daily lives. And what are those public health measures? One, physical distancing. That has to continue, not social distancing, but physical distancing. You could be social, but physical distancing. I am urging the public to wear masks when you are outdoors. When you are in public, please wear masks. Continue the hygiene of sanitization of all surfaces. Cough etiquette is important. Stay home if you are ill. That will help us manage the next 2 weeks. And you know, if we manage the next 2 weeks properly, as was said on Saturday, it is then possible to crunch the other phases, even though we have timelines. If we conduct ourselves responsibly, stay home if you're ill, avoid touching your face, wash your hands, wear masks, physical distances, it is quite possible that we don't see the upsurge in cases which we expect from this weekend coming. And the Chief Medical Officer will speak in detail about that as we start to ease the measures from today. The symptoms will start to show up from this weekend. So if we conduct ourselves properly, it is possible to advance phases 2, 3, 4, let's not look 5 and 6. But it all depends on our collective responsibility and to keep on holding the line for 2 weeks. Minister Cox, I want to thank you very much for the opportunity this morning.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Good morning, Honorable Ministers, members of the viewing and listening public. The clinical update for today, Monday, the 11th, 2020 is as follows. Samples submitted to the UE as well as CAFA labs, 2,312. Repeat tests thus far, 341. Tests for unique persons, 1,971. Positive tests remain at 116. The number of deaths remain at 8. Hospitalized patients stand at 1 at the Cuba facility. Within the Penal Debe UE facility, there are 70 persons who remain in quarantine for a further few days. And at the Napa and Port of Spain, there are 23 healthcare workers presently quarantined. In terms of community samples, we stand as of the 9th of May, which was Saturday, 687 community samples completed thus far. All of them were negative. I just want to take the opportunity to clear up one discrepancy, which there's not a discrepancy in the number, but with regards to the patient at Cuba. So I received some media calls yesterday and my corporate communication department asking about the patient in Cuba. So it is, first of all, it is not the patient that was there in the high dependency unit. That person actually received their 2 negative tests over the weekend and was discharged from the Cuba facility, so is no longer a COVID positive patient. However, that patient had, as you may have known before, that person had pre-existing medical conditions and has now been transferred to another facility within the RHAs where she receives appropriate medical care. The person at Cuba now was actually a patient that was housed at the home of football, started to experience some mild clinical symptoms, and out of an abundance of caution, we decided to take her back into Cuba to have some tests conducted, which they were, and she's being kept in Cuba until she awaits her negative discharges. Minister Cox, that's my clinical update for today.
Thank you very much, Dr. Parasram. At this time, we just want to say happy belated birthday to you because a lot of persons have been telling me that it's your birthday and they want to wish you happy birthday. So I'm doing it on behalf of all the people of Trinidad and Tobago. Thank you for your service to the people of Trinidad and Tobago.
Thank you very much, and thank you for everyone that wished me well on Facebook and other forms of social media. It really assisted me greatly in getting forward and having a good birthday, although we are all in this stay at home.
Thank you. The Minister of National Security, the Honorable Stuart Young, will address issues related to the latest regulations and the government's management of the various measures, including our borders. Minister Young.
Thank you very much, Minister Cox. Good morning to my cabinet colleagues, Minister Cox, Minister Deyalsingh, to the CMO, and to the viewing and listening public of Trinidad and Tobago, and of course, our members of the media. Good morning. This morning, we published regulation number 13 under the Public Health Coronavirus Regulations, as we call it, and it's under the Public Health Ordinance. There are just a few issues I'd like to draw to your attention and to let the public know how we intend to deal with this first phase one that both the Prime Minister and the Minister of Health have alluded to in speaking to the population. First of all, public transport remains the same. 50% is what we're allowing in the maxis, in the taxis, etc. All of these measures, of course, are decided by the government after close consultation and the advice of our medical public health experts. And every single measure is done to protect the population of Trinidad and Tobago. With respect to public gatherings, we still have kept it at 5, so there to be no social gatherings in public places, apart from the essential places, of more than 5. With essential places, and I'll get to what we call itinerant food sales, which are what we know as roadside food sales. The gyro man, the hamburger man, the hot dogs, the selling of drinks from a cooler, doubles, all of these various things. Pies, I heard the Minister of Health refer to. I'll get to what we are really asking for the assistance on these things is please, social distancing, physical distancing continues, and we're asking that the vendors place your markers, the 6 feet apart, and that people adhere to it. But I'll get to the regulations. No more than 5 persons allowed to socially gather in public places. We have also, whilst we've eased up the restrictions on exercising, and people can conduct themselves in outdoor exercising, no more than 5 persons in any gathering. And we specifically said in the regulations, you cannot participate in any sport or team sport which involves more than 5 persons. That will be a breach of the regulations. We're asking people to adhere to this. Of course, we've kept the beaches or rivers, streams, ponds, springs, or other bodies of water closed during this phase, and we ask people to continue to adhere with it. All I'm doing is highlighting the new measures. Everything else remains in place. Workers who feed and look after and feed animals at farms, zoos, and animal shelters, you are allowed to conduct that feeding and to go along your business. With respect to agriculture, I'd like to make this specific point. Agriculture, food production via agriculture is 100% unimpeded. In fact, last night we added a regulation that services and workers engaged in construction related to agricultural and food production, including land preparation and any activity related to agriculture and or food production, is allowed. The message is there is absolutely nothing in the public health regulations that impedes anyone from conducting any business from land preparation, construction of the necessary infrastructure for agriculture, the planting, the reseeding, everything related to agriculture is permitted, and we took the further steps of just making that even clearer in this latest set of regulations. To get to the specifics, hardwares, as you know, we've allowed to be open now every day from 8 a.m. to 4 p.m. We've said now, street vending of food and beverages, all retail food services, delivery and takeaway food services shall only be open for sales to the public until 8 p.m. every day. This is a measure where we've opened back up that industry, and it includes all of the food items, itinerant, non-itinerant, and you're allowed to sell until 8. We're asking people, please close off at 8. This is being done for the specific public health and regulations and to allow us to be able to police it, for want of a better phrase. Retail services, you could continue to be, such as the markets, supermarkets, fruit stalls, vegetable stalls, bakeries, parlors for the provision of food, etc., can be open for sales to the public until 6 p.m. This is a measure we've all become accustomed to. We've gone through a number of cycles with it. The pharmacies remain at 8 p.m. So we know how these regulations are intended to work, and by and large, businesses have been conforming with it. What I'd like to now point out, though, we have made it an offense for any in-restaurant dining, and by restaurant, it's not only the formal restaurants. in all of our different outlets that sell food, there is to be no in-house dining. That is now a breach of that, would be an offense under the regulations. Importantly, we are not allowing on-site consumption of any product provided by a street vendor selling food or drink. This is a very important regulation that now gives our law enforcement the power to deal with persons who breach this regulation. So when you go to your food vendor, your street vendor, to collect or purchase your food item, be it gyro, hamburgers, hot dogs, whatever it may be, please understand that you're not allowed to consume it on site. Take it, move on, go away, go to your homes and eat the food, etc. But we are not allowing persons to congregate on site to eat these various food items. And to do so will be a breach of the regulations, and the police will be entitled to charge you for that. That is very important. Also, when you are going to your various food outlets, please, as you heard the Minister of Health say, wear your mask, cover your nose and your mouth. Also, personal hygiene is important, and the social and physical distancing. The Trinidad and Tobago Police Service were aware of these regulations. I've been in constant communication with the Commissioner of Police, and they are going to be stepping up their continued police efforts with respect to keeping us all safe. So that is the first thing that I wanted to deal with. So everything else remains the same. We've been bombarded with a number of questions. The tire shops, the mechanics, those are not permitted. The auto spare parts are not permitted. Nothing else has been permitted apart from this. This is based very carefully on the advice we receive from the public health experts. The management of preventing the spread of the COVID-19 has been going fairly well in Trinidad and Tobago. It's something you as individuals are responsible for. Please continue to work with us, work with everyone to make sure we keep everyone safe. The next issue I've come here this morning to deal with is our borders. As you all are aware, we closed our borders to nationals and non-nationals on the 23rd of March. That exercise, as difficult as it is, and it is not based on any individual whatsoever, it has been managed very, very carefully. The importation of the virus is what got us that 116. We stopped the further importation by closing our borders, and we will continue to manage our borders very carefully. And that's the point I want to emphasize. Part of the management of our borders is, as you would have seen, as we allow certain people in, certain groups in, after very careful consideration and discussions with our public health experts, they have been going into state quarantine. The reason for that is it allows us to ring fence and to manage the people that we allow back in. So the state quarantining is a very, very important measure for those that we allow back in. Of course, there are limited facilities for state quarantining. So as we go forward, this is how we are dealing with the management of our borders. We continue to receive hundreds of applications from persons or nationals out there. You've heard us say time and time again, there are over 330,000 persons with Trinidad and Tobago passports. I continue to get requests from Ireland, from Saudi Arabia, from India, from Germany, from Russia, from the United States, the United Kingdom, and other various CARICOM countries. As you heard me announce last week, right now we're dealing with those from Guyana and those from Venezuela, and we're looking at it. There's another important exception that we're going to deal with next, and I want to send this signal here today. Our students who are in Barbados and in Jamaica, we are going to be putting things in place. I am dealing with the principals of the various institutions in Barbados, Cave Hill, and in Mona, Jamaica. This morning, I had a conversation with the principal at the University of the West Indies, St. Augustine campus. What we're going to be looking at is in the first week of June, and we've already spoken to Caribbean Airlines, we will be planning an operation for Caribbean Airlines to go to both Barbados and Jamaica to bring back our local students. But there are important conditions that must be fulfilled. The students who wish to come back, and this will be coordinated by the principals of these various institutions in Barbados and Jamaica. It is not a personal reach out to minister and a personal reach out to anyone here in Trinidad. We're going to carefully coordinate it with the principals in Barbados and in Jamaica. Every student who wants to return via this very careful operation is going to be quarantined in Barbados and in Jamaica for 14 days. That is the first condition. You will be quarantined in Barbados and Jamaica for 14 days. We are then going to arrange with Caribbean Airlines, once we ascertain the number, to take students to fly up. We've been in discussions with Barbados, and we're going to conclude those discussions. We're going to speak to the Prime Minister of Barbados to make the offer that students in Barbados who want to return, once the Barbados government welcomes it, we will take them to Barbados. We will then go to Jamaica, bring down the students from Jamaica to Barbados and to Trinidad. But you must quarantine for 14 days there. You must also then, when you return to Trinidad, you will be put into state quarantine for another 14 days. It has been suggested, and I want to completely debunk that suggestion, that the government abandoned anyone. The government of Trinidad and Tobago has not abandoned any national, including our students, wherever you are in the world. What we've done is carefully managed, after getting the advice and consultation with our public health experts, the population here. And as you've been seeing, we are carefully managing those returning to Trinidad and Tobago. There are hundreds of cruise workers out there. Other CARICOM islands, I think I heard the number for Jamaica is in the region of 7,000. For Trinidad, we have over 300. So bombarding and attacking the Minister of National Security and saying that I am preventing, it is simply not so. I have always conducted myself in whatever ministerial portfolio without fear or favor, malice or ill will. I don't see the individuals. We have a job to perform, and the job is to protect the people in Trinidad and Tobago. Continue, nationals, to shelter in place where you are. So there will be more information provided as we go forward. I'm going to have continued discussions with the principals in UE, the principals in Cave Hill and Mona during the course of today, who will be asked to coordinate with the students in these two jurisdictions. You are going to be asked to quarantine for 14 days in Barbados and Jamaica. We will make the arrangements with Caribbean Airlines and bring you back. And when you arrive here, there will be another 14-day quarantine period. The next conversation that I'd like to have is there seems to be a continued proliferation of misinformation and misleading commentary taking place with respect to the visit of the Venezuelan Executive Vice President, Ms. Delcy Rodriguez, on the 27th of March of this year. As you've heard the Prime Minister, the Honorable Prime Minister, say, Trinidad and Tobago's position, as is CARICOM's position, is guided by the UN Charter. So at this stage, the UN Secretary General has advised from very early o'clock that the United Nations recognizes the Maduro government. We have no horse in the race. So in our continued recognition, in accordance with our obligations to the United Nations, a request was made in the first week of March by the Executive Vice President, Ms. Delcy Rodriguez, to come to Trinidad to speak to the Prime Minister. Ms. Rodriguez was appointed, I believe, on the 26th or 27th of February as the lead coordinator for the COVID response in Venezuela. Everything that happens in Venezuela has an effect on Trinidad and Tobago. We're 7 miles off of the coast. Ms. Rodriguez came. There was no question or no asking of, well, what are you coming to discuss with us? The Prime Minister returned to Trinidad and Tobago on the 10th of March. I had a conversation with him thereafter. There was a plan for Ms. Rodriguez to come in, I believe, on the 16th of March. She then contacted me on that weekend to say she had developed a bit of a flu. In those circumstances, I asked Ms. Rodriguez to delay her trip to make sure that I protected Trinidad and Tobago and for us to ensure it was not anything related to the COVID virus. Authorization was given. At the ministerial level, when I give authorization, I do not drill down into the type of plane, who owns the plane, nor do I ask to say who is the manifest, especially when it's a foreign government making the request. And I will give you other examples. The United States, who we continue to have an extremely good relationship with and who at National Security I work with on a weekly basis, made a request just a couple weeks ago for 2 military planes to land in Trinidad, to leave Trinidad, to come back to Trinidad. I just gave the approval because it is the United States government asking. I do not know who came on those flights, but what the condition is that they couldn't disembark. They picked up personnel in Guyana, they picked up personnel in Trinidad, they left. I don't know what type of planes came in, who came in on the planes, etc. The same requests have been made by other governments who asked for repatriation of their citizens. The same request was made because we're running an energy sector that is the lifeblood of revenue for Trinidad and Tobago. So in working with the other upstream companies, the energy companies, as you all are aware, there was one weekend when 5 charter flights came in. I don't ask who is on the charter flight. Is it a Gulfstream? Is it a King Lear? What type of plane it is? Who owns the plane? But that information is provided. The public service processes that information. So the same thing applied. There have been many visits by the Venezuelan government over the past few years, way before even the sanctions came into place. At no time have I ever asked what plane it is, which plane you're coming in on. This whole conversation, Trinidad and Tobago, began with certain voices, Trinidadian voices, first of all starting and focusing on the sale of fuel by Paria on its route to Aruba. That is how this conversation began. So those who were not in the know started a conversation. Did Trinidad and Tobago, through Paria, sell fuel to Aruba that ended up somewhere else? We have investigated this. And I'm happy to say that the contract was a very clear contract with that sale of fuel to Aruba, which has happened in the past, because Paria supplies fuel throughout the region, including to Aruba. There is an important condition and clause that was in that contract. And that condition and clause by Paria in the sale of fuel to Aruba, or for transmission to Aruba, had an important clause that said that that fuel is not for any sanctioned country. It is not for Iran, it is not for South Korea, it's not for Venezuela. So that is how Paria protected Trinidad and Tobago in the sale of fuel. They're told that it is for Aruba. There was the insertion of a clause, a specific contractual condition that the fuel is not for a sanctioned country. So that debunks this whole conversation that Paria or the government of Trinidad and Tobago negotiated or entered into any sale of fuel. This story arose by certain people in Trinidad. Up to today, in the newspapers, one of them suggesting that, well, I don't know if this happened, but if this happened and there was a sale of a fuel in this manner, this is what it means. The answer is it did not happen. A very careful contract for a normal sale of fuel took place with a condition it is not to be provided to any sanctioned country. That is the first point. And as soon as that whole tower started to crumble, that whole conversation coming from certain quarters in Trinidad, in a manner meant to create disinformation, in a manner meant to try and put us under scrutiny by our very close ally, the United States. The next thing we had is an appearance of certain manifests to do with the plane. As I've stated very clearly, as the Minister of National Security, with a request made, I authorized the Executive Vice President of Venezuela to come for a meeting with the Honorable Prime Minister. Up to Friday, when I heard the leader of the opposition, I did not know what type of plane they came on, who it is, etc. I've also heard it suggested that it is not true that we did not know who this delegation was. Exactly how it unfolded, people of Trinidad and Tobago, is at that stage there was COVID, so we were very cautious. The persons who could come into the room to meet with the Prime Minister was limited. We only met 2 people, the we being the Prime Minister, Minister of Foreign Affairs, Minister Moses, and myself. That was the extent of the Trinidadian delegation. The extent of the Venezuelan delegation that we met with was the Executive Vice President, Ms. Rodriguez, and a Mr. Chavez. Mr. Chavez was not introduced to us as any vice president or president of PDVSA. In fact, at the time, we've subsequently found out he was on a commission for the restructuring of PDVSA. That meeting took place on the 27th of March. It is only on the 28th of April, a month and a day later, the same Mr. Chavez was made the president of PDVSA. So once again, you have people trying to mislead the population, but worse than that, not only mislead the population of Trinidad and Tobago, but attract attention from one of our closest allies, the United States, by saying that the Prime Minister and his delegation met with a president from PDVSA. That is completely untrue. The other people who were on the manifest, we did not meet. We did not even come into contact with them. We saw them, they were brought in, and they went down a corridor into a housing bay. The status of the meeting was we even had the Venezuelan contingent of 2 in PPE gear because we were so concerned about COVID. The conversation was about COVID. The conversation was about the 16,523 people who are registered in Trinidad and Tobago who are Venezuelans, plus the more that may be here. So all of these suggestions, all of this creation of disinformation, misrepresentations, which they can only answer as to why they are doing it, there is simply no truth to it. We did not meet anyone else from the delegation apart from Ms. Rodriguez and Mr. Chavez. Mr. Chavez was not the president of PDVSA at the time we met with him. We did not know the type of plane. We did not know the rest of the delegation. And at our level, meaning the cabinet ministers accompanying their prime minister, that is not an unusual occurrence. I have accompanied the prime minister and Minister Moses into the US Congress within recent times when we've gone into meetings with US senators, with US House of Representative leaders at the highest level. And you see sitting behind them a number of support staff. At no point in time are we ever told who those support staff are. So this whole creation of this whole smoke screen, I completely debunk here today. I completely say there is no mischief on the part of the government of Trinidad and Tobago. We continue to work in full transparency. And as I was reminded by the Prime Minister, immediately as the meeting finished, and it was not a long meeting, and Ms. Rodriguez and her delegation left, we did not even do our traditional greetings because of the distancing, because of COVID. Immediately as they were leaving the diplomatic center to return to Venezuela, the Prime Minister's office issued a release in full transparency that the meeting had taken place and what the meeting was about. So I remind the population the conversation about the sale of fuel by Paria is covered. The sale of fuel by Paria contained a condition that it is not to go to any sanctioned country. We had nothing to do with that. Then this whole idea of a smoke screen and who's playing and who was there, we met with 2 persons. It was not the president of PDVSA. That was a courtesy call with our closest neighbor to discuss what was going on with COVID. We do not know who the other members of the delegation were, and we never interacted with them. There were security personnel there. I saw Ms. Rodriguez's personal secretary and assistant, but that was it. The only 2 people we met with in that meeting were Ms. Rodriguez and Mr. Chavez, who was not the president of PDVSA. So for the leader of the opposition and others to now say we met with the president of PDVSA, he only became the president of PDVSA on the 28th of April, a month and a day after the meeting with us, the Trinidadian delegation. So I hope that these facts, which are irrefutable, will now put to bed for at least the right-thinking and the civic-minded citizens of Trinidad and Tobago. I'd just like to end by saying, the United States, despite all you may be trying to do, those in Trinidad and create this mischief, continues to be our closest ally. I continue to be in constant conversation with our friends in the United States. We had one of the largest drug busts 2 weeks ago. It went under the radar because of COVID. $663 million worth of illegal narcotics. And that was a transaction conducted by our Coast Guard, our special units, our intelligence forces, and our US allies. We continue to plan training with the United States Army. We continue to work very carefully with other agencies who form part of law enforcement and intelligence in the United States. I had a personal conversation with Ambassador Mondello last week at his request. We continue to have that very clear, transparent, candor, conversation and communication with our allies in the United States. And this government intends to keep that going, despite those who are attempting to create mischief and misinform you, the public of Trinidad and Tobago. Minister Cox, thank you very much.
Thank you very much. Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means with our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. Trinidad Express.
Good morning. Leah from newspapers. My question,
Sorry, we
Hello.
Yeah.
Your connection is not clear, so we will come back to you. So could we go to ACP News, please?
Right, to apply to reach
Connection is not clear. Could we go to ACP News, please?
Good morning, Prior Vicari, ACPnews.com. Minister Young, I just have a question for you. I see you have always maintained that the meeting with the Venezuelan VP and entourage has always been about COVID-19. And it's also been a short meeting. So my question is, why couldn't that have been done via phone call, via Zoom, via WhatsApp? You know, why was it? Why did it have to be? You know, they have to come, you know, via plane and entourage. And the CMO, I just wanted to find out about the contact tracing for 115 and 116. Has that been completed? Those are my questions.
Okay. First of all, Mr. Bihari, I cannot answer the question why it was that the Venezuelan vice president requested the meeting and came via the modality that she did. As a matter of courtesy, a request was made to us, the government of Trinidad and Tobago, for a high-level meeting, and that meeting took place. There are many things that I see taking place all over the world, right? At the end of the day, it is a fact. That is what took place. For you to say, I maintain that position, because it's a fact. I can't change the fact. I can't change what I know to be the truth. She came for a very short meeting. There was no pre-discussion with respect to agenda, but I will tell the population that is not at all unusual. I recall, and I'll permit myself to say this, it was about 3 years ago, very early one Sunday morning, getting a call from the United States that POTUS would like to speak to the Prime Minister. A quick processing, President of the United States would like to speak to the Prime Minister. And I spent the next few hours arranging for that call to take place between the United States President and the Prime Minister. At no stage in that conversation did I ask, what would the President of the United States like to talk to our Prime Minister about? That certainly doesn't take place at this level. When world leaders are talking, that just doesn't enter into the space unless there is something very specific. I missed a call this morning from Downing Street. They were trying to call me as we were here, from 10 Downing Street. I didn't ask them over the weekend, what is the agenda of what you wish to discuss? So that simply does not take place because there's a level of courtesy and there's a level of how you interact. This government and this administration has been very much about relationships and the building of relationships. When you're having bilateral meetings, I have seen it happen at Chogam. The Honorable Prime Minister and the Minister of Foreign Affairs go off to meet the Prime Minister of India, Prime Minister Modi. I've seen them meet with the Prime Minister of Canada, Prime Minister Trudeau, and these types of conversations on bilaterals. There's no discussion beforehand. Well, tell us who is there, show us the agenda. So that is what happened. And I can't help you all to create any misinformation or to go down those roads. It's just a fact of that is how it happened.
CMO.
Okay. CMO?
Yes. So in terms of the last two cases, 115, 116, as you will recall, 115 occurred more than 3 weeks ago. So more or less the case investigation for that particular incident has concluded. For 116, we have concluded the contact tracing for the primary, secondary, and tertiary contacts, which we know that concluded yesterday because all of them would have been followed up for their 14 days. None of them developed symptoms. However, for the hidden contacts, which would be people that we would not have known about, we still continue to look out for those through the normal healthcare system for approximately a week or so, because people can convert late into the incubation period and still be having symptoms. So for about a week or so, we will continue that tracing and looking for possible contacts, hidden contacts out of 116.
Thank you very much. 98.1.
Good morning, very good morning to the head table, Stephen Cummings, 98.1 FM. Two questions, one for Minister Deyalsingh and the other for Dr. Parasuram. Minister, as we begin to realize a measured relaxation of the COVID-19 public health order, mindful that the virus remains very much alive, I'm wondering what our immediate emergency response plan would be like in cases of even, let's say, a small cluster spike. Does it mean that we could be going back to a full-scale national lockdown, or would there be considerations for quarantining of a specific area? Dr. Parasuram, how far are we prepared to go in the use of technology testing? There is one report that says that several countries have been doing test trials developing COVID-19 human contact tracing, developing apps. The technology uses Bluetooth, for example, as one of its main contact tracing digital features.
Okay, so thank you. I will take 1.5 of the questions. I will also take a stab at the Bluetooth question. So, what do we expect? We have set up the parallel healthcare system, which was born out of an idea which I had in January. The parallel healthcare system has now upped its capacity from 922 beds to over 1,000 beds because we have activated the other wing at the Couva Hospital. So we have just come out of treating 116 persons. The resilience of the parallel healthcare system was proven when in one fell swoop, we had 40 cases coming out of the cruise ship cohort. For a small country in one day to absorb 40 cases without missing a beat, that would have been a knockout punch for many other countries of our size. So the direct answer to your question, what we expect starting from today, and as I said, the symptoms will start to manifest themselves by this weekend. We have over 1,000 beds allocated for all symptoms from mild to moderate to severe, step-down facilities, convalescent facilities, and how the virus and the population behaves over the next week in particular, which is a very nervous time for us. I don't think the CMO and myself will be sleeping much from about Friday or Saturday. That will determine how we move forward. And that is why all the public health measures have to be in place. On the second question of technology and Bluetooth, it is something we are looking at, but I'll tell you what are the pitfalls of it. We have to get an opinion from the Attorney General, and I plan to write him this week, because there are serious privacy issues with the Bluetooth connectivity. A positive COVID patient, from my understanding, has to put on his phone that he is positive. Question, will you be willing to do that? So that when somebody with another device is close to you, it triggers a response. The other question is, how private is your data on that? So there are serious privacy issues. The Bluetooth technology is used mainly in large countries where you have large geographic areas to cover. We are two relatively small islands. What we have proven with our 64 cases outside of the cruise ship component is that using the GIS technology and contact tracing, we have done a pretty good job. So we have to weigh the pros and cons of our existing GIS technology, which is based on IT, versus Bluetooth, which may have some serious privacy concerns, But for now, our GIS tracking system is working very robustly. So I hope that answers both of your questions.
CMO, is there anything you wish to add?
No, not at this time.
Okay, thank you very much. We go back to Express.
Hello, good morning, and I'm sorry for the wrong. My two questions are for Minister Young. Minister, I know last week you said that you began to authorize those who applied to return from Venezuela. My question to you is to ask the Venezuelan government to allow the trainees stranded in Venezuela to return, because I know they're saying that you need to communicate that they're granted an exemption under an exemption order to the Venezuelan government. Secondly, Mr. Young, can you say what exactly was discussed regarding COVID-19 with
Minister Young, are you hearing?
I heard.
Are you clear?
I heard the first question in very broken terms, but I have a general gist. I'm not hearing you at all.
Yes, it's not
on
clear.
the second question.
Could you answer that first
I'll
question?
answer the first question. Okay, we have gone through this before. We went through it with Suriname. We went through it with Barbados. It is very easy for all sorts of persons to put out certain information, misinformation about government is required to do this. The process and procedure is the government has indicated that we are granting approvals for those applications that are in front of me as the Minister of National Security for the persons in Venezuela. The Venezuelan authorities, the persons in Venezuela will make their own arrangements, and then they will notify us of the arrangement. There's nothing really for the Trinidad government to be doing at this time. I've indicated the permission will be granted, so I'm not running after any red herrings and this type of thing. We have done our part. It was the same thing with Suriname. We did our part, and then the persons there are to make their own arrangements, and we will do what we need to on this side, and that continues to be the case.
Okay, thank you. If it's anything, we'll get back to Express. We have been experiencing some problems. We go to 91.9, please.
Hi, good morning. Verne, Extavour, 91.9 FM. The Minister Young, some time before, you had mentioned about the use of mechanics, tire shops, and that kind of thing, especially for those who service essential services and essential vehicles and that kind of thing. However, this morning you did mention tire shops are not supposed to be open. If we could get some clarity on who those mechanics or tire shops that will be allowed to operate, who service, essential vehicles and that kind of thing. If you get some clarification on that, if it does exist. And I also wanted to find out about the students who will return from Jamaica and Barbados. In terms of their schooling going forward and that kind of thing, has that been a part of the conversation? Will that be part of the quarantine arrangement for them when they return to Trinidad and Tobago? Thank you. Good morning.
Thank you very much for those questions. The first is, if you go, and it's always been in the regulations from day one, so if you go to the regulations, and in particular at Regulation 3, and you go down, the exact language is found at Regulation 3 Roman 4 on page 467. Automotive repair and maintenance facilities only to provide direct support to identify the essential services in this sub-regulation. So that's what the regulations have always stated. Persons with auto repair parts, stores and tire shops, etc., we have been told have been opening and conducting a business, some of them clandestinely. The police are aware of what the regulations are. I've just read out the specific regulation. That is not permitted at this time. Understand that all of these regulations are measures put in place after consultation and the advice of the public health experts to prevent the movement. As the Prime Minister was at pains to continue to repeat on Saturday, we are still asking persons to stay at home. The regulations still stipulate that it is only essential workers and essential businesses. What we've done is we've added today restaurants and the sale of food and beverages as another category, but it still comes down to just essential workers making movements during the stay-at-home period. We're trying to contain the potential spread of the virus. So tire stores, auto part stores and stuff, they're not supposed to be open according to the regulations. Your second question with respect to students, I didn't quite understand. At the end of the day, what we are going to be doing is working with Caribbean Airlines, who have already been spoken to for the first week in June, to make this run to bring our students back home. At the end of the day, it's up to the students as to what it is they want to do. I will remind people, at the beginning of this, the Prime Minister had been in discussions with other CARICOM leaders. I personally had been speaking to the principal of St. Augustine to find out the numbers of students Trinidadian students who were at schools in Cave Hill and in Mona. And when we were making the arrangements to bring home those students, quite a number of them indicated they wanted to stay there, they wanted to stay in school, there were exams taking place. There's a lot of uncertainty with COVID all over the world, so you don't measure it now. Put yourselves back to that period of time when we were initially going to put these arrangements in place. So the students are the ones who then indicated they wanted to stay in place because they didn't want it to affect the examinations. I personally don't know what is the exam timetable, etc. But we're looking at the first week of June. It will be a personal decision by every student. The conditions we're putting on it is you will be asked to quarantine for 14 days there, and then you will be put in state quarantine when you return here. By now, if people haven't realized in the management of COVID-19 globally, it is not life as usual. Difficult decisions have to be made. Difficult personal decisions have to be made. It is very difficult as an individual, as a person, reading all of the requests for exemptions, but that's my job. That's what I must do without fear or favor, ill will or malice. With people telling me how they're stuck in foreign countries, in Saudi Arabia, in Russia, in India. But you just have to give consideration. So with respect to the students, each and every one of them will have to make their own personal decisions, and that's why we're dealing with the principals. The principal will put the conditions and the stipulations to them, and they will decide what it is they want to do.
Thank you very much, Minister. Folks, we are almost out of time, so I would like to ask the persons I call to ask one question, please. We're just trying to get as much persons to pose questions to us. So we move to TTT.
Good morning, Khrystal Wilson from TTT Limited. A question for the National Security Minister. A number of nationals abroad, particularly those with expired passports, they are expressing concern that when the time comes and borders are in fact reopened, what's the next step for them? With embassies closed, consulates closed, they have little information. Are you able to advise?
Okay, so the first thing is right now, the vast majority of countries, their borders are closed. There are no commercial flights. I am not sure of the exact number that you're talking about, but I know it was a stipulation for a lot of countries. They wouldn't allow you to come into their country if you had under 6 months left on your passport. So I'm hoping it's a small number of persons you're referring to. But the point is, when we reach the stage that commercial flights are going to be reopened, our embassies or consulates abroad, our high commissions abroad, the Trinidad and Tobago high commissions, consulates and embassies abroad will also be back out of business as usual. And we will do what we have to do at immigration to facilitate when we reach that stage and we have commercial flights coming and there's less border restriction. We at immigration will be able to issue either emergency travel documents or to work with other countries or even the airlines to say, look, these passports granted an extension for 3 months, 6 months, whatever it is. We'll cross that bridge when we get to it. But as I told one national who reached out to me yesterday from Ireland with an expired Trinidad and Tobago passport, don't panic. Let's see how this thing unfolds. At the end of the day, you're a national of Trinidad and Tobago. And when we reach this stage of you being permitted and you can make your way back home, we will do what we have to do. We will facilitate it. And we went through that when the borders were closing. The PS and myself were up to 1 o'clock in the morning with flights leaving other countries, issuing documents to airlines in New York, in Toronto, for persons to get back home. It will be a much easier process at that stage, and immigration will deal with it. I'm not concerned.
Guardian Media Limited.
Hi, good morning, everyone. Chester Sambrano, Guardian Media.
Morning.
My question to Minister Young is, in the interest of the transparency that you spoke of, would the government now be willing to make public the minutes of that meeting with the Venezuelan president and Mr. Chavez, so the country could see what exactly Mr. Chavez's role and contribution was in that meeting?
Thank you very much, Mr. Zambrano. Mr. Zambrano, as I indicated, it was the executive vice president of Venezuela. The prime minister has spoken about what took place in that meeting. It was only 5 persons in the room. There are no minutes of the meeting. What we discussed was matters related to COVID. We discussed the Venezuelan population in Trinidad and Tobago. We asked how was COVID being managed in Venezuela. There was even an offer of test kits from Venezuela to Trinidad. We said no thank you because they have a much larger population and a lot of restrictions on them. Mr. Chavez was quiet in the meeting, and as I say, at the time it wasn't even known what Mr. Chavez's role was. He subsequently became the president of PDVSA a month and a day later. At that stage, it is a prime minister, a minister of foreign affairs, a minister of national security, the executive vice president of Venezuela, and someone who was on a commission for the restructuring of PDVSA in a meeting discussing COVID. No one was sitting down writing notes or minutes to present. I have given you the information as to what was discussed, as has the Prime Minister.
Just a reminder, one question, please. Newsday.
Yes, Julian Neal from Newsday. Minister Young, just some clarification. You mentioned the clause in the contract with Aruba. I wanted to find out, if you recall, what would be the penalty of breaching that clause? And have we confirmed that Aruba did not indeed sell the fuel that we sold to them to Venezuela?
All right. Mr. Nees, you have to understand, I have not personally sat down with the specific contract, the sale, the bill, whatever it is. So when this thing arose in the public domain from certain quarters with these allegations, obviously at our level we wanted to find out what was going on. Requests were made of Paria. I spoke to the chairman of the whole Trinidad Petroleum's Holdings Limited, because that's the level I would speak to. I was told about this. They've put forward a document where they have outlined to us how the sale went and that there was this specific condition. I am not sure what the breach of that condition may be. And let us still get back to reality. As far as we are aware, the fuel was sold by Paria for onward transmission to Aruba. So all of this speculation with respect to breach of sanctions, and I'd like you all to know that even when I spoke to the US ambassador last week, the US's position is they have seen this in open source documentation. Open source documentation means what is floating around there on social media and in the media. No one has come forward and said, this is what happened with the fuel. And we are saying, but the documents in our hand show a sale to Aruba, where there's a specific contractual condition that says it cannot be for a sanctioned country. I don't think there's much more that we could do.
Thank you. Thank you, Minister. TV6.
Hi, good morning, everyone. Question to the Minister of National Security. Pictures of the meeting suggest Minister Franklin Khan was there. What was his purpose in the meeting?
All right, thank you very much for that question, Mr. Lachman Singh. I've been wondering for quite a while. There were no pictures in the meeting, so I've been smiling and I'll tell you quite honestly, wondering, because I've seen pictures in the media, I've seen pictures of me in Venezuela meeting President Deyalsingh on a previous trip that was in September last year. I've seen pictures and I heard it said by the media, these are photographs of the meeting between the Prime Minister and Vice President Deyalsingh. Those are old photographs. That picture that you refer to is actually 2 years ago, 2 years, if not 2.5 years ago, when Vice President Deyalsingh and the then Minister of Energy, Major General Quevedo, came to Trinidad and Tobago, and we were discussing and pushing along for the Dragon deal. So that's over 2.5 years ago that photograph was. And then it's being suggested that is a picture and a photograph of the recent meeting on the 27th of March. There were no photographs and pictures of the meeting on the 27th of March. It was a quick in and out. Everyone was conscious of time and also that it was a COVID discussion. So all of these pictures I've seen floating and the media holding it up as though those were pictures of the meeting itself. They weren't. You all go back to the press release. There were no pictures of this meeting on the 27th of March. So Minister Khan was there in that previous meeting. I was there as well with Minister Moses, and we were discussing with the Executive Vice President the Minister of Energy for Venezuela, and others, the whole Dragon deal. So that was over 2.5 years ago, if I remember correctly.
I-95.5.
Morning, Jonas, I-95.5. Minister Deyalsingh, since the announcement over the weekend, there have been small business persons who are saying that they would like to reopen in short order because they don't have the resources of large businesses. And if they are not permitted to reopen anytime soon, chances are they may not reopen at all. And that would put more persons on the breadline with the attendant socio-economic impacts. Is there anything that you would like to say to this particular group of people?
So it's an unfortunate narrative that has been reflected to say that we are only catering to big business. It's unfortunate because at the start I said the doubles man can open. That's small. The nuts man could open. The pie man can open. The small restaurant can open. So I am really disappointed that the narrative is being played out there that we are only opening big business. That is simply not true. I have given you all those examples. The small mom and pop restaurant that was closed can open. All these small businesses can open in addition to big businesses. And I heard one big business last night said they employed 3,000 people. That is 3,000 small people who are now back in a job, earning a salary. So I am really quite disappointed by that narrative. But we cannot flip a switch and open everything at the same time. And if you would permit me, Minister Cox, to illustrate this point, that if we do that, we will regress and we will seesaw. I would recommend that everybody get a copy of a book called Epidemic. I got this book in 2014. It talks about how the world did and did not manage Ebola. And everybody is now familiar with somebody. And I'm going to quote a line from him. We don't want to make this out a real big problem, the official said. It will be terrible for business and stigma. Anthony Fauci, who everybody knows now, in 2014 said this. Anthony Fauci, participating in a call from his office, almost fell off his chair, so shocked that business was the major concern in the face of one of the world's most deadly diseases. Ladies and gentlemen, we must learn from the Ebola outbreak of 2014. Let me just quote a last part. In an increasingly interconnected world in which everyone is 1 or 2 flights away from New York or London or Beijing, even a localized epidemic can become a pandemic. This was in 2014. Are you seeing a parallel? Ebola spread through West Africa to Nigeria, the United Kingdom, and the United States, sounded global alarms that the next killer outbreak, they were predicting this in 2014, that the next killer outbreak is right around the corner. Does that sound familiar? And listen to this last line. And that the world is woefully unprepared to combat a new deadly disease. Ladies and gentlemen, we are faced with a global pandemic that was predicted, that was clear, staring us in our faces. The solution to the business problem is not a business solution, but a public health solution. Unless we solve the public health part of this problem, then schools can't reopen, as you saw in South Korea. They have to rethink schools opening. We have listened to our public health experts locally. We have paid attention to every country that did not do this sequentially, in phase basis, that have to seesaw back and forth. We don't want that here. I am urging all of us, especially those who have a microphone, not necessarily the media, but leaders who have access to the media in whatever sphere of activity you reside. This is not a time to see after your own narrow interests. This is a time to rally around our public health officials who are advising us. Let us learn from the mistakes of South Korea, as I indicated this morning, California, Wuhan, and every other country that started to do rapid opening up and then had to seesaw back to lockdowns. We are coming to the national population with a well thought out phase opening, and if we survive the next 2 weeks as indicated on Saturday, it is possible to crunch those other phases. And I just touched my face again. But we can only do that if we are sensible, if we put aside sectoral interests and listen to the public servants who have guided us brilliantly to date. And I hope that answers the question, Minister Cox.
Thank you. CNC3.
To the ministers. Hello, good morning. Hello, good morning. Jesse Ramley from CNC3 News. Hello.
Yes, we are hearing you. Good morning. We are hearing you.
Hello.
Hello, we are hearing you.
Hello, good morning.
Okay, it seems like
Good morning.
Jesse has some audio problems. Could we move to Loop TT? In the meantime, we'll go back to him. Loop TT. Can we get on to Loop
Hi.
TT, please?
Good morning, everyone. Nika Pasanal here from Loop TT. Can you hear me?
Yes, we are hearing you.
I don't think the panel could hear me.
Yes,
We're hearing you.
Yes, we are hearing you.
Oh, okay. I just wanted to know, is there any sense of nervousness within the cabinet about the relaxing of these restrictions, particularly with food? We've seen quite a lot of long lines, not today, but before the restrictions were imposed. Are we worried that people aren't going to take them seriously? They're not going to social distance? What have we put in place to kind of ensure that we don't see a need to have to revert, as you mentioned earlier, Minister Deyalsingh? That's for both of you.
So we'll both answer. So yes, the Prime Minister opened his press conference on Saturday. His first line was, "I am nervous." I opened the press conference this morning, "I am nervous." We said so publicly. So yes, we are nervous because we know whilst most of the population may be responsible, take what happened with the quite unfortunate death of that young lady going to a COVID party. That is the type of activity we don't want. And we know not all 1.4 million people will be responsible. The virus is there waiting to spring. The virus is there waiting to attack because certain people will be irresponsible. I took a walk along Park Street this morning from my office all the way to Frederick Street. I stopped in a few eating places. Many of them are taking the necessary steps. Outside TN Tech, they have marked out 6-foot markers. Outside Eastern Credit Union, I visited there this morning. I saw the guard allowing one person at a time. I went to Linda's on corner of Frederick and Park. They were actually spraying everybody's hands at the coming. So I visited 2 doubles vendors, one in the gas station by El Socorro and one on Green Corner. Many people are being responsible, and I want to congratulate small, medium, and large-sized people who are being responsible. But what is going to be key moving forward is how the virus moves from person to person with this heightened level of activity. And reopen the economy we must. But it has to be based on the advice of the public health people. And so far, from the CMO go down, they have not let us down. They have been spot on in all their recommendations. But moving forward, personal responsibility is going to be important. Thank you very much. I don't know if Minister Young wants to add.
Just briefly, as I said at the outset, and I'm glad you raised this, there are instances we're getting reports of persons who are congregating and gathering, especially at the roadside vendors who are selling food. So there are photographs already circulating of persons one on top of the other, very close together. The social distancing is applicable, the personal hygiene is applicable, you're supposed to wear your mask. But the important regulation, I just want to remind everybody, you are not allowed to consume the food product provided by a street vendor on site. The police will enforce that if they have to. We're asking persons collect your food and move along. But before you do so, please socially distance. Please don't gather. Because at the end of the day, if we see that this congregating of persons starts to have an ill effect and a spread of COVID-19, we will revert. We're not afraid to put things back in order to protect the population. So please be personally responsible. Thank you.
Thank you very much. We go back to Jesse. CNC3.
To round from CNC3 News here. Minister Young, given the now recent changes to the regulations and your admittance that the interpretation of it could lead to police making errors, what steps are being taken to mitigate this as to avoid incidents in the past?
Well, I mean, we've now been doing this for well over a month, almost going on 2 months. There've only been a handful of instances where the police have gotten it kind of wrong. I mean, not fully wrong. They didn't arrest anyone and charge them or anything like that. The police will continue to be sensible. I continue to have my daily meetings with the various heads, and I know the commissioner from since yesterday was briefing his executive, and they have been in turn briefing the men and women under them. So I understand, and I believe and I predict that the police will continue to do a great job as they have done. I'm just asking people to please work with the police so we don't have to use the full extent of the regulations and charge anyone.
Astronaut Health News.
When it's Stewart, Astronaut Health News. Good morning, everyone.
Good morning.
I'm concerned, Dr. Parastram, I'm concerned about hypercapnia, which is said to be caused by rebreathing your own exhaled carbon dioxide. I want to know, can wearing of masks for a prolonged period lead to carbon dioxide toxicity? And can we give can we establish some guidelines for workers and others who spend long hours wearing masks?
Dr. Parasram?
So there are guidelines for healthcare workers that need to wear masks for prolonged periods of time as to how long they should be wearing a mask, in what sort of circumstance. So that has been used in the past in Trinidad and around the world. There's some research that would have suggested that certain types of masks you would be more prone to hypercapnia, which you have indicated. As you go up in terms of the grade of mask, like N95, for instance, which only allows, which actually filters 95% of the particulate material, the greater the constriction in air. So as you go to cloth masks and those sorts of things, you find that there should be a limited amount of hypercapnia associated with that use. But just be reminded that we are asking people to go to whatever, if you're going to a supermarket for a restricted length of time, do your shopping quickly and return to the safety of your home, meaning that your mask should be worn in a public space, but only for a limited period of time. So we should not see this phenomenon developing. And just to remind everyone that children less than 2 should not be wearing it, and those, of course, less than 5 who may not be able to tolerate it very well shouldn't be wearing it as well. There are certain people with chronic diseases who will have difficulty breathing when they're wearing masks. They would know from history how they are feeling. They may be seek some medical advice prior to doing so as well.
Okay, thank you, Doctor. I think we have a picture that we want to put on the screen. Minister Young and Minister Deyalsingh was speaking about physical distancing.
That's right.
This was taken today. Minister Young, do you want to comment on this picture?
Thank you very much, Minister Cox. So that's one of the photographs that was sent to us as we were here. Of course, it concerns us. But what I'm seeing is I'm seeing a fella, for example, in front of the pole on the red with his head down and looks as though he's eating. We're not allowing on-site consumption. We really don't want the congregating of persons exercise social distancing. Please be aware that it is now against the regulations for you to have on-site consumption of whatever is the food you're purchasing. People, we just need to stay home, stay safe, continue with the discipline, please.
And let me just add, you see that is what will encourage us to reverse phase 2 and phase 3.
Yes.
That is what you don't want.
This is happening today.
That is what is going to slingshot this country back to where we were last week. So it's not only the public has to be responsible, the food vendors also have to discourage that and make sure that there is social distancing. That is what will slingshot us back to last week.
Definitely, definitely. We move on to CLC.
Hi, good morning. Sonolala, Caribbean Lifestyle Communications. Minister Young, you said Paria inserted a clause of the seal is for the sanctioned country. Is this common practice? How long has this been going on for? Or was it just for this seal to Aruba?
All right, I have to smile. I don't have the answer for that as to how long it's been going on, etc. I don't really, quite frankly, see the relevance. The point is there was a clause that said that the sale of this fuel is not for any onward transmission to any sanctioned country. I guess it would depend on who it is they're transacting with, etc. I don't have the answer as to how often, why it was inserted. I'm happy it was inserted because it shows immediately that all that was done by Paria to protect the country against any sale of fuel to any sanctioned country. And it wouldn't have only been Venezuela. Sanctioned, there are many sanctioned countries, as I say, Iran, South Korea, also other sanctioned countries.
Thank you very much, ministers, Dr. Parasram, members of the viewing and listening audience, members of the media. We have come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As you know, today begins the first phase of the reopening of our country after weeks of isolation. The Prime Minister, on the advice of our public health professionals, has eased some of the restrictions, which means restaurants, other food establishments, and street vendors can offer curbside pickups, takeout deliveries, and drive-through services. We still cannot dine in, but we can go out to exercise, hike, and enjoy fresh air, of course providing we adhere to the guidelines on physical distancing and do not gather in groups of more than 5 persons. We must also continue to wear our masks when in public spaces because the risk is still very present. This first phase offers some respite, but we do know it is not what you have become accustomed to. And if you're like me, you're anxious to get back to your churches, mosques, temples, and wherever you worship. We know that you want to see your family and friends and to commune with each other, but we must hold strain a little while longer. In fact, if we are as disciplined as we have been in the last 6 weeks, even more restrictions will be lifted. But first, we must continue to follow the public health guidelines to protect us and our loved ones. We must ensure there is no worrisome change in our numbers. It is the only way out of this alive and healthy to enjoy the things we treasure. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.